Welcome back to another episode of Christian Natural Health. Today, I am excited to have Dr. Richard Ruhling with us. Dr. Ruhling was board certified in internal medicine and had a cardiology fellowship before teaching health science at Loma Linda University, a community featured on the National Geographic cover story on longevity as the only blue zone for health in North America. There, he gained insights on how the body is designed for self-healing without the need for prescription drugs that have become a leading cause of illness and death. Welcome, Dr. Ruhling. Thank you so much for joining us.
Thank you so much, Dr. Lawrence. Good to be with you and with an ally.
Yeah, absolutely. So tell me a little bit about your paradigm shift, because you started in the traditional allopathic world and then you went to Loma Linda and everything kind of shifted. What was that journey like?
Okay, well, I really wanted to be a missionary, and I went to Loma Linda to take medicine and be a medical missionary.
Mhm.
And a favorite author made a statement, founder of Loma Linda,
Mhm.
who really did not want drugs taught in her school. She wanted to have natural remedies.
Yeah.
And sadly, administrators hijacked her school to get AMA accreditation. That seemed to be a good deal to them, but she said no, and bad situation. I struggle to understand her statement that drugs change the form and location of disease. And I couldn't understand how that my medical school was teaching me pharmacology when she made the statement. She was considered actually a prophet, Seventh-day Adventist.
Yeah.
I'm not denominational. I'm no longer a member. I believe they made so many stupid mistakes. But basically, she was very accurate, which is why NIH gave my school $40 million to learn why the community Adventists live about 7 years longer than other non-smoking groups. And
Mhm.
it was really because of her writings. And in her writings, she said the drugs change the form and location. She did not use modern terminology like cholesterol. That was before that time.
Sure.
But now we call adverse drug reactions exactly what that is. It changed the form and location. And I have a personal experience that helped me with that.
Mhm.
Former wife had a bladder infection, went
Mhm.
to her doctor for a prescription, and uh, she took it for an antibiotic. She took it for about 3 days, didn't need it anymore, just took it as prescribed.
Mhm.
But months later, she had a rash. And she went to her doctor again, who called urgently the next morning after a blood test and said she needs to see a hematologist. She has no platelets.
Mhm.
And he put her in the hospital, did a bone marrow, took out her spleen, treated her with high steroids, gamma globulin, transfusions, in and out of hospitals till she died of a stroke from
Oh,
an antibiotic that she took for 3 days. Um, Huge situation. And now I understand Ellen White's statement that it changed the form and location. She had a bladder infection, died of a stroke. Uh, that apt description from what we call adverse drug reactions, which are now a #1 cause of death. Really, medical literature supports it, but the CDC never reports it in their top 10 list. They're liars in business with pharma, and don't they may think if they don't say something they're not lying. Well, they're, the public look to them for this and that, and it's a tragic situation. Even today's headlines about lamenting the fact that the vaccination rates are low in children, dropping. Well, uh, I reared 6 children. We adopted 4, and none of them ever had any shots. They all grew up healthy. We don't need the mercury that's in those shots that can give autism, et cetera, as far as I'm concerned.
sure. Yeah, absolutely. So backing up a little bit, can you tell us what a blue zone is? Like that's what got your support there. What does that actually mean?
Well, it was reported in the National Geographic cover story of November 2005 that featured the Loma Linda community. And they call certain, it's the only blue zone in North America for healthy living. Actually, I had one of my teachers died a couple years ago, November, at 104. He helped teach surgical residents until he was 95, standing in surgery at age 95, still training them. And one of my teachers, just about a year ago, I got a Christmas card. He had a chainsaw in a tree down. He was 95 at the time. So I'm 81, but I'm looking for good stuff.
Amen. Absolutely. That's fabulous. So when you began to kind of have your perspective shift, How hard was that for you? I mean, at what point did you actually kind of flip over and say, maybe what I was taught wasn't the way it really is?
When did it shift? I practiced medicine with um, for example, if I had prescribed for my wife, I would have used ampicillin, because penicillin, unless you're allergic to it, is not a real problem, you know. But doctors go with the newer drugs, the stuff that is the latest and the greatest. In fact, every week in a medical office, you have a free lunch someday when the drug company is locally sponsoring the meal, and this is the latest and greatest for the doctor. Okay, bad situation. Basically, it's like letting the fox guard the hen house in many, you know, we really, I stayed with drugs that I knew to be within my scope, and I would try to encourage them towards healthy lifestyle so they don't need the drugs, basically.
Yeah, exactly. So, just out of curiosity, was it a quinolone, the antibiotic that they gave?
It was Cipro.
Okay. So, okay. So, given your work on cardiology and internal medicine, what is your perspective on heart disease now? How do people prevent it, and what do they do if they have it currently?
Okay. I have on a website a introductory video showing how that most diseases are reversible by diet, like vegan. The video is vegan. I've been vegetarian most of my life. My current wife fixed some animal products, but it's not a dominant thing every day or every meal. And so I would just say that is healthy stuff. Uh, Prescriptions people pay thousands of dollars for in a year's time, some of them more than that. Just if they can do it without, and I would say go to the website, is health, happiness, destiny. Those are three words everybody wants. No, and just healthhappinessdestiny.com, and watch an 8-minute video. And if they want, they can um, that full video I offer as a part with a book as well. So basically, tell you about it later maybe, but that's what I would say. Eating, what we put in our mouth is the main thing of what makes our body. You know, it's not the air, it's not the water. Yeah, those things can be a trouble if you got something bad in it, you know, but basically healthy habits of what the body becomes comes from the common entry path, the mouth. And so it's our choice what we put in our mouth. So it's diseases of choice that we've got. Which ones do we want? You know, and people can get used to a diet that isn't quite as rich and quite. If we learn to eat what we like, and you can throw something in the salad besides oil, grease, and you know the salad dressings are usually high in fat, but throw a few beans or peas or tomatoes, whatever, in the salad, and it still tastes good, or apple slices.
Yep, absolutely. So mostly it's just make sure that you're eating whole food the way that God made it, essentially.
Yes, good for you.
Yep, absolutely. So, and then you had a little teaser in here. A popular beverage is the most overlooked cause of a dozen medical problems. So I'm assuming you're going to say soda, but what, where are you going with that?
The brown liquids, coffee, actually.
Okay.
I know, and lots of Americans do it, or tea, but I could just start at the top. High caffeine is insomnia and nervous disorders. Okay, and basically going down the body, cleft palate, hereditary defect. You see little kids with you know, we want to sponsor the surgery. Well, it's caffeine in the first trimester, high doses, and heart. I in my cardiology training, they didn't allow caffeine in the coronary care unit. It could trigger a fatal arrhythmia, ventricular fibrillation. It causes extra heartbeats, and in the context of a heart attack, could be bad. High acidity in the stomach. Caffeine turns the stomach acid on. You have gastritis, ulcers, GERD, gastroesophageal reflux disease. My daughter got breast lumps drinking the Cokes and Pepsis in a night shift at the hospital. She couldn't stay awake, and her breast lumps went away when she quit the caffeine. And cancer of the pancreas, reported in 1981 in March issue of JAMA. I'm sorry, New England Journal of Medicine, leading journal. Several hundred cases of proven cancer of the pancreas. compared to the control groups. The people who wrote the article quit drinking coffee. Okay, cancer of the bladder also.
Okay. Wow, that's amazing.
Um,
I wonder,
osteo
just out of curiosity, with respect to the cancer of the pancreas, do you think it was because of like the contaminants in the coffee, the solvents and whatnot, or do you think it was the coffee itself? Or does, I mean, they usually don't speculate on mechanism, but I was just curious.
I don't know, but my favorite author said it causes coffee and tea causes problems of every stripe and type. So I would just say not just contaminants maybe, but caffeine is a drug basically, and we think it's just nicotine is a drug clearly. Caffeine keeps you in balance, by the way. And if you try to quit smoking and you have all the stimulation of caffeine, you can't quit. You need another smoke to balance your nerves. And so they go together. As Pavlov called coffee bad habit glue. It glues our bad habits together. We can live lousy and we would never wake up in the morning for the job unless we get it going with the drug, caffeine.
Yeah, that enables you to keep doing it. Gotcha. Interesting. So, what would you say to somebody who's already on a very long list of pharmaceuticals? Where would they start?
Well, exercise is a good way to start. It makes you less picky about what you eat. Okay, and so then you can. And I would say the video that I have available, or link online, Health, Happiness, and Destiny, is excellent on motivating people. I've had people. It's the best tool I have found to try to get people to change their diet, basically, because it documents on the video so many benefits from eating well. And there's a wide variety of fruits, nuts, vegetables, things like that we can eat. It's not just I eat very well now. I've got a good my wife is a good cook, so I just say I can do that.
Yeah, yeah, awesome. So, what about acute illness? So, there's certainly a lot of that going around at the moment. What are some of your favorite natural approaches to dealing with acute illness?
Well, for acute things, I do think that medical care has a place. You need to know what's the cause. I was taught in medical school from a teacher who had graduated from Harvard. He said they taught him at Harvard 50% of what we teach you is not true. Well, the half that's really bad is the treatment, with the drugs. But diagnosis is really not a true diagnosis because they're not telling you what's the cause. Most of the medical textbooks say unknown etiology. They don't know what caused it because they don't talk to people about what they eat. Okay, just so it's a bad situation. But I believe that diagnosis, especially in acute problems, can be helpful. It's just that if you have cancer, I wouldn't want chemotherapy or radiation. And in fact, the video also shows that idea. And people have beaten it with natural remedies and good diet, basically.
Yeah, absolutely. But what about like acute short-lived illness like the flu, for example, or a cold like that? What would you suggest for that?
I was working in emergency room one night when I was catching the flu. Scratchy throat, runny nose, achy, felt cold, took my temperature, and it was normal. They taught us in medical school that viruses are killed or arrested faster with a fever. So here I am, a sitting duck, no fever. What can I do? I took a break, 20 minutes, filled a tub in the hospital with as hot as water as I could stand, and soaking up to here in my ears, I had in 20 minutes a fever of 102.5. And as the water was running out, it actually felt good to pour cold water front and back. Contrast hot and cold can double your white blood count. So twice as many soldier cells circulating, and I didn't eat any supper, so those white blood cells would be hungry. We get flu after the holidays, Christmas cookies, cakes, candies, and all the goodies. Well, none of that. Fasting is better for the immune system. It makes the white cells hungry. And I felt pretty good. I saw my patients till 11 and decided that the bath had helped me. So I did it again, a second hot bath, fever treatment, finished with cold, went to sleep. In the morning, I had no symptoms. It was all gone. I aborted the flu, okay, with no drugs. I didn't even have vitamin C, but it was just the diet and etc.
Yes, hydrotherapy is amazing. Absolutely.
Yeah.
Okay. And then what about people who are struggling with weight loss? I'm guessing I probably know where you're going to go with this, but what would you suggest that doesn't involve super strict dieting where, people aren't starving themselves?
Okay, I do have a tip or two for that most people haven't considered. It's not just calories, it's also when you eat them. Okay, what you eat for breakfast, you can burn up through the day. I eat an early afternoon meal, but nothing at night. Okay, and fasting, there's benefits to intermittent fasting. You can read it in the literature, and so why not fast from the if I can't last from afternoon of one day to next morning, it's big trouble. We should be able to last that long. uh, you said I'm Christian basically, and I see that Christ fasted 40 days. Surely I can wait till tomorrow morning, basically.
Good perspective. Yep,
Yeah.
absolutely. So, yeah, that's great. Very cool. So, what have I not asked you that you think is important to leave with our audience?
Oh, natural is best. We don't need to fry things, if it has a weight problem. I think organic is more and more necessary, and animal products are more and more dangerous as they try to squeeze every dollar out of every cow, even feeding them manure to get more nitrogen in their diet, along with the hormones, antibiotics, and things that they inject them with. We had a lady who worked at a chicken plant, but also cleaned house. She said she would never eat a chicken. That was 40 years ago that she would never eat a chicken. I don't think it's any better today. So basically, I just say stay with nature. And as another cardiologist said, if it grows out of the ground, it's fine. Yeah. Well, even now there's so many sprays and things. Go organic as much as possible.
Yeah, yeah, absolutely. So you alluded to your book. Tell us more about it. What is it called and where can people get it?
Well, I couldn't find a copy real quick, but this one here shows the cover from Health, Happiness, and Destiny at the website healthhappinessdestiny.com. And it was the Grady Harp, MD, top Hall of Fame Amazon reviewer, top 100 Hall of Fame. He said, splendid book and highly recommended. So if they want something on the topic of health and other things, I think it's helpful from that website. I would just say, even as an example, I'm coming from a Christian perspective. Christ said, study the book of Daniel when he was asked about the end times. And in the book of Daniel, Daniel opted out of medical government health care in the first chapter. Basically, I think stay away, run from the government. They're trying to control us all with what, etc. So big trouble. Don't. The media is hijacked with all the money they're making from pharma. And by the way, in the book of Revelation, the word pharmakia is the Greek word that deceives all nations. Okay, that's in the 18th chapter, verse 23. Badly translated as sorcery. Sorcery deceives all nations. But the Greek word is pharmakia. Why would they translate pharmakia as sorcery? Except that maybe it seems like magic, but it's not magic at all.
I'm going to go study that. Very interesting. Very interesting. Okay. And can you say your website one more time?
Okay. 3 words: healthhappinessdestiny.com. And there's a book DVD tab at the top that they can watch a video and get more if they like, whatever. Thank you.
Yeah, I will link to that in the show notes. And thank you so much, Dr. Ruhling. This has been fantastic.
Hey, God bless you. Wish you well. And if I can help anytime, let me know.
Thank you so much.
Right. Bye.
Are you looking for a holistically minded healthcare practitioner who truly treats root cause rather than symptom suppression? Unfortunately, even in the alternative healing professions, this isn't a given. That's why I've created wholehealthdoctor.com, a resource to help connect patients to healthcare practitioners in their area who share a root cause philosophy. Alternatively, most of the practitioners listed also practice telehealth. So if there isn't anyone local to you, you can still find a great practitioner to help you regain optimal health. Go to wholehealthdoctor.com. That's wholehealthdr.com. Type in your location or adjust the specialty that you're looking for and find the practitioner who's right for you.